Hi, this is Walt Fritz, physical therapist from the United States. I'm really pleased to be returning to Athens on May 10th and 11th and May 17th and 18th in 2025 to be teaching a few more of my Foundations in Manual Therapy, Voice and Swallowing Disorders seminars. The May 10th to 11th class is the introductory class. The May 17th and 18th, 2025 class is the advanced class. We've kind of built it this way so for people who are coming in from outside of Greece, they might consider a Greek vacation. You know, that's exactly what my wife and I are going to be doing during that time between the two classes. But whether or not you're coming for the introductory class or you've already taken the class and you're coming in for the advanced class, I really do hope you consider joining me in Athens. The introductory class is a 2-day workshop, lots of hands-on, but lots of challenging narratives on how manual therapy works, how manual therapy doesn't work, and how it can apply to the specific patient populations of not only the speech therapist, but the physio, the occupational therapist, the massage therapist, the osteopath, etc., working with issues of, we work our way through the face, oral motor related issues, tongue related issues, whether it's for articulation, clarity of speech, singing, swallowing, post-head and neck cancer, surgery, radiation-related issues, and much more. We then move into the hyoid and laryngeal region for issues relating to very similar things, but in addition, globus, airway issues, etc. We spend time in the upper chest wall and diaphragm regions as well. This work is much more than just learning manual therapy. It's maybe learning or relearning manual therapy from a very strong shared decision-making perspective. Manual therapy has been traditionally taught from a clinician as expert model, one where the clinician learns the anatomy, the physiology of problems, and then becomes the able giver of intervention. They dictate the intervention. And while that work and that model certainly has merit in our literature, it's missing an aspect that's become a much more important part of manual therapy and therapy in general, and that's shared decision making. This class is entirely built upon a shared decision making model, which requires us to let go of our ego a little bit. Let go of our ego and elevate the perspectives of the patient to a place where they actually have value in the interaction. The introductory class is all about that and lets the clinician leave with not only an understanding how touch can be impactful for the various disorders, but how shared decision making can really empower and invest the patient into the interventions. The advanced class, it's not really about teaching advanced techniques. It's about teaching the work taught in the introductory class from the perspective of experience. From you've been through the seminar, hopefully you've had a chance to apply it at least minimally with some patients, to come back and learn deeper, work from our struggles, work from our successes, and deepen the work taught in the introductory class, but also expand it into aspects and areas of postural, of carriage, of things like that. We move through some of the same techniques that we teach in the introductory class, but we expand it into other areas of the chest wall, the shoulders, the diaphragm, the face, etc. There's much more information available on both of these classes at my website, which is waltfritz.com. The registration links are going to be available for both of these Athens class very shortly, and I do really hope that you consider coming to Athens, meeting with me, and spending some time in this lovely country, lovely city, the Greek Isles, etc. Whether you're just coming for the one introductory class, or maybe considering staying for both, or possibly just coming over for the advanced class. If you have questions, feel free to message me from social media, message me from that website, waltfritz.com, and I'd love to answer your questions. So hopefully I'll see you in Athens in 2025 May.